Hello, I was just checking in today. This is Friday the 12th, and this is the first Friday after the second round, the first day of the second round. So I have had officially 3 chemos. Should have had 4 by now, but I've had 3 because we skipped the first week. And I've had 5 Herceptins and 2 Progettas. There's the update. I'm feeling pretty good today. I was nauseous a bit on Wednesday and Thursday. Definitely seemed to kind of take over a little bit. I was able to work a little, but I had to cancel a few folks because I just didn't feel like I could go the whole day. So trying to be easy on myself and cut down when I can. Today I felt pretty good. I have mostly fasted today. I just had an apple and keeping it light. But I wanted to check in and just let you know that, hey, I still have hair. I have noticed it starting to fall out a little bit more. I'm doing a lot to keep my skin more moisturized, which has really helped with some of the tallow. And keeping like my nasal passageway moisturized has helped quite a bit with the bleeding. So today I was thinking about just talking a little bit about vitamin C. I used it a lot in the beginning, and actually it's common that a lot of patients who have advanced cancers are deficient in vitamin C. Well, I've been taking vitamin C a while, and I've kind of taken a little bit of a different turn on it. I am at the moment trying to get it in more with my foods, like my berries and spinach and some of the dark leafy green vegetables, things like that. I am still taking some supplement form, but it's from Whole Foods. I'm not doing the ascorbic acid as much, though I sometimes throw it in, but I have lessened the ascorbic acid because that's like, for a teaspoon you get 4,000 milligrams, so 4 grams, and it's ascorbic acid, and you only absorb about 10% of ascorbic acid. So with the Whole Foods one, it might be, 200 milligrams, so it seems like nothing, but you absorb most of that. So I'm trying to add the more natural stuff in right now because I'm not trying to get at the high doses at the moment, since the high oral doses, which never get as high as the IV form. But, if I even got up to like 4 to 6 to 12 grams, I think my bowel tolerance in the past, I tested it, got to 16 grams. But that's when I took it pretty regularly in the past. So I'd probably be at 12 now. And what that means, that bowel tolerance, is when your belly starts to feel cranky and gassy and bloated and uncomfortable. Some people's skin itches. This can be just from like having too much vitamin C. You've hit your max. It is a water-soluble vitamin, so it's fine. It's just not comfortable feeling. You can't absorb that much anyway, so it's not worth taking it to that limit. So I'm taking kind of on the lower dosage to this, at this point, since I'm on chemo. In the beginning, I was taking high doses. So I was taking the ascorbic acid form 2 to 4 times a day, 4,000 milligrams. So there were times I got up to 12 grams a day. Especially on the days in between, I was doing high-dose vitamin C. So high-dose vitamin C is an IV form of vitamin C, and you can get, up to 100 grams, so 100,000 milligrams. But most of the time you get up to like 50 to 75 grams, which is a lot. But this way you're bypassing your stomach, so you're not having to absorb the vitamin C through the GI tract. You're able to do it through the blood, through the IV that's going directly into your blood. So you don't get any of the crampiness or the uncomfortable feelings. I will say it is uncomfortable to get those IVs because they tend to be in a really big bag. A lot of sodium is in there. So anytime you're over about 60 grams, I've learned it puts a significant strain on the kidneys to have to deal with mostly the amount of sodium that's in those bags, but it's a lot of volume of fluid. So in the beginning, before I had a port access, I was doing it into my veins, which I still do when I go for the Hydrate Asheville Place. I'll do some high dose C every once in a while there, and they do it through the veins. So some facilities will do port access, some won't. But it's very uncomfortable when you go into the smaller veins on the high dose C. It's just like super cranky and sore and uncomfortable. And I don't know if it's just the amount of pressure or the fact that the vitamin C is sort of caustic, kind of like feels corrosive almost on my veins, like it's like really irritating because it's acidic. So could be some of that. So I actually got up to 90 grams at one point when I was doing vitamin C, high dose vitamin C very often. I got up to about 90 grams. I also, in the beginning, added it with ozone. I had ozonated therapy, which is when they take out a pretty large amount of your blood and then they spin it with oxygen, ozone, essentially an O3, an extra oxygen molecule bound, and then back into the body it goes. That was interesting. I'm not sure it's necessary to do that. I almost think that those therapies would be perfectly fine just separate of each other. High dose vitamin C only has about a 2-hour half-life in the body. I did notice I didn't have a lot of testing with the ozone and high dose C, but when I only did like 1 or 2 of those. When I had my continuous glucose monitor in for the first month, kind of in December, I was monitoring everything I was eating and just wanted to know what foods were causing a spike in glucose. But I will say I didn't test it a lot then because I was really strict. I went very strict, cruciferous vegetables, kind of keto route. So I have 1 more month of that continuous glucose monitor, and I will test that after I'm done all of this and I start adding other foods back into my diet just to see where I'm at, because everybody reacts different to foods. But with the high dose vitamin C, I did notice with the HBOT, and I had the glucose monitor, I could see that my glucose shot up. And this might make no sense to you guys right now as far as high dose vitamin C and why it would relate with glucose. But there is a way to measure it with glucose. It's not actually your glucose going up. It's just the way the molecule is sort of perceived. So you can measure your effective dose with glucose testing. So usually you'll check it before you get the IV. Let's say I'm at 80, and then I check it again after the IV, and I'm at, 380. If I'm at 380, I didn't quite hit the therapeutic dose. So that would mean I only went up 300 milliliters per deciliter, I think it is. So, or milligrams per deciliter. So what you really want is to get into a therapeutic dose of 350 to 400. And so you want to bring your blood glucose up that much. So if I was like, let's say at 100, let's make it easy on me. If it was like 100 resting glucose set, then I could go up to 500, and I would have essentially, if I went up to the 500 level, I've definitely gone over 400, so I'm in the therapeutic effective killing zone dose, where high dose vitamin C actually is not an antioxidant anymore at these levels. Really, I believe it's over 12 grams or so. Anything over 25, I know for sure, is not an antioxidant anymore. So as soon as it gets over 25 grams, it becomes pro-oxidative. What that means is it's actually helping the oxidative process. So that's kind of like what chemo does. So it's encouraging a damaging effect on the cells that can't handle it, hopefully the cancer cells. High dose vitamin C, luckily, is a little more selective than chemo, so it will actually create hydrogen peroxide in the cell. And it does this at the oral doses, which is why it's kind of helpful for anti-inflammatory mediators, because it'll help bind to this ROS, or reactive oxygen species. That's what's essentially creating the oxygenation or the oxidative damage to tissues like our DNA, which can create cancer in the first place. Too much reactive oxygen species, too much damage to the DNA, you got cancer. So hopefully the lower dose oral stuff helps mitigate the ROS, but the high dose vitamin C has just a really oxidative effect on putting and making hydrogen peroxide in a cell, and it does tend to go for cancer cells. So it has a pretty good track record of targeting on cancer cells and damaging them, getting them to create apoptosis, so cell death. So it's pretty awesome for that. There are a decent amount of studies on this. There need to be more studies, but again, it's not really a money thing. I also think from doing this therapy a lot, I think it comes down to the quality of the vitamin C. A lot of places are getting kind of that lower quality. It's like the corn, it's basically corn-derived vitamin C, which is kind of just like ascorbic acid. Essentially, it's derived from corn, which could be GMO. So it's then questionable if synthetic vitamins are ever any good, but you can use them to your advantage, and they're cheap. So I think there's a time and a place for them, but I think ultimately I will not be moving forward with ascorbic acid long term in my daily oral supplementation. I will stick with whole foods and just kind of push myself to get in the amount of antioxidants and berries and flavonoids and polyphenols and all the other things in some of the fruits and berries instead of leaning into a supplement. But there are some wonderful ones, so the ones from Whole Foods I think are a good idea. I would just say some of the cheaper ascorbic acid ones, maybe when you're traveling and you want something cheap to bring, they're fine. They're in most products that you think of for your health. That's actually usually ascorbic acid. It's just a lower grade vitamin C. It's not that great. So anyway, I leaned into vitamin C pretty hard in the beginning. I was doing it like 2 to 3 times a week because it was one of the very few therapies I had to lean on to create an anti-cancer effect, or at least to sort of slow things down. I do think it really helped quite a bit. You do have to get tested up front for the G6PD test to make sure that you can tolerate high dose vitamin C. Some people don't, and they have hemolysis. They essentially bleed out. It's like internal bleeding. So I didn't have that, thank goodness. There was also a concern about tumor lysis syndrome, which is if you have a large tumor, and it's not necessarily my type of tumor, but if you have a large tumor, it could be very effective, the vitamin C, and it could create a sudden death of the tumor, which your body has to process. Your body has to detox that. So that's a lot on the body. So that was a bit of a fear, not as much with vitamin C. That was actually when I was seeing someone that was sort of underground, and we were talking about doing like an injection that would have killed the tumor from the inside. Just kind of creeped me out. I just got a vibe that I shouldn't be doing that because it hasn't been well studied. Not that most things are well studied, unfortunately, because of the money aspect in the cancer industry. But this one was sort of like, ooh, it's a veterinarian drug. It's very effective at helping giant cell tumors fall off people's legs, dogs' legs, and things. But, I haven't seen it go into a breast tumor. What happens? Does my breast fall off? Like it sort of was one of those things that I was like, I think I'm going to hold off. That'll be a last case scenario. If I'm really in a bad spot, we'll try it. So I think I made the right decision on that. But it was just one of those learning points where, you're kind of desperate. And at the point I was not really willing to jump on conventional treatment yet. I was really trying to figure out all my options. I was willing to travel a lot of different places. So luckily I didn't have to do that. But vitamin C was a great help for me. I really find a difference when I go to certain practitioners that use higher level vitamin C. And there's also ways you can ask your practitioner to cut the sodium level in the bag. It's basically like a half bag, so higher concentration. Some places won't do it. I've got a place here that won't do it. Probably not the best source stuff, but it's less expensive than some of the other places, so I keep them in the loop. Otherwise, if you go to the right place, like even the Mistletoe clinic that I go to, they'll do less sodium bags, which I do not do vitamin C with them right now. I'm focusing on Mistletoe and sometimes resveratrol IVs. But, I think when I go back to doing IV vitamin C after, for supportive healing, for any kind of circulating tumor cells, I will make sure I choose the high quality. I think that makes a big difference with that therapy specifically. So that's my 2 cents on vitamin C, both oral and IV form. I think they're very effective for many types of cancer. We need vitamin C. We don't get enough of it in us. It's a big issue with how our foods travel these days, so you can't always rely on it in foods alone. You do have to really push the amount of fruits and vegetables you get in that have high sources of vitamin C, but it is possible. So give it a shot. Get some vitamin C back in your diet. It's wonderful for your skin as well, and helping to incorporate collagen back into the healing process. So it's a super amazing therapy. And I hope you guys have a great weekend. It's Friday, so that's a good day, huh? So hopefully everybody has a great weekend. I'm hoping not to be too tired and get a few things done this weekend. And then I hit some Mistletoe on Monday. I've got a friend driving me down there, so it should be a lot of fun. And then I've got day 2 of round 2 on Tuesday for conventional therapy. I hope you tune in. Thanks so much. Bye-bye.